All right.
Anybody else that don't have a raffle ticket? Raffle ticket. That was it. You have a raffle ticket.
The number is 830028.
Hey!
On behalf of 40 Days and 40 Nights Ministry, we want to say thank you for coming out and supporting us.
Oh, wow. Oh, did they want something?
Yeah, they said no. Okay. At this time, we're going to ask our own Irma Romero to come up and speak to us on mental illness and coping with mental illness.
Shit, me?
No,
Y'all know I'm crazy.
you can't cope.
Y'all
You
can see
can't
it,
cope.
right? Oh.
You can't cope.
Good afternoon, everyone. My name is Irma Romero. I'm a licensed clinical social worker. I work at Highland Hospital as a licensed clinical social worker. I work with adults who are experiencing depression, anxiety, post-traumatic stress disorder, and or um, may be experiencing grief due to the loss of a loved one. Um,
Hey, is that good enough? You want the lower? Is that good?
I hope so. Yeah, I think that's
Okay.
fine.
Do you want me to pass these out?
Okay, so I also work individually and have worked in Oakland for since 2012 in individual private practice. So I work at Highland in between the adult clinic as well as the women's clinic. So I often see people who are coming in due to crisis. One of the things that I really want to say is it's important for everybody to understand that there is help out there. Um, One of the things that I really want to emphasize is if you see someone that is struggling, please encourage them to seek out help through their medical provider. If someone doesn't have a medical provider, like a hub, there are clinics within the Oakland, City of Oakland or Alameda County where you can go to get help. The other thing, if you see someone struggling, I also want to just bring to your attention, if you're having a difficult evening, you see someone struggling, there's always the number 988, like 911, but 988 focuses on mental health. There's always someone available to talk to. So just please know that. So what are coping strategies if you're having a difficult time? It can look very different from someone who's experiencing depression or someone who's experiencing anxiety. But the first question is recognizing that you're not your usual self. That's the biggest thing. Sometimes it's really really hard to say, I'm struggling after the loss of a loved one, or I'm struggling after I've lost my job, or I'm struggling because I'm in an abusive relationship. So it's being able to like recognize, hey, something's not happening for me. Some of the other thing that you can also just like be self-aware of, am I finishing my household chores? Is it hard for me to get out of bed? Am I suddenly not taking a shower? Those are some of the signs that you can sort of see within a friend or even yourself, like this is not normal for me. Um, okay. So as the previous speakers talked about, people experience depression, people experience anxiety, people experience post-traumatic stress disorder. Um, Being aware of like what's going on with your life. So how do you struggle? How do you cope when you're struggling with that? You talked about talking to a medical provider, calling 988. So when I, as a therapist, am working with someone who is like, who comes to the emergency room or comes as a patient of mine, and they're like, I just had a loss, or I just, experienced a traumatic event, I begin by just asking them, well, how are you eating? How are you sleeping? Are you moving? So it's really important to really kind of go to the basics. And I tell people when I'm working with them in therapy, like the next few months, we're really going to just focus on eating, sleeping, and getting movement. That's one of the most important things. It's like if I'm not eating enough, I'm going to feel tired. I'm going to feel like fatigue. I'm going to feel like I don't have energy to do anything. If I'm not sleeping, I want to ask everybody here, how do people feel after they have not slept through the night? You feel
Anxious?
yeah, yeah, anxious, irritated, on edge. So it's really important to look at like, okay, I've just experienced something, whatever it may be. I need to really get to the basics: eating, sleeping, and movement. You have a beautiful space out here. Movement, even if it's just you're walking from one end to the other, that will help you cope with whatever it is that you're dealing with. What else can we do? So one of my big things that I love to encourage people to do is coloring books. So you have one of the biggest tools that I like to use in my own practice, which is coloring. You're doing drawings or painting today. In my packet, I've included in the last page a mandala that do that before you go to bed. It will help calm you. You had like you're feeling a lot of anxiety. I think the microphone is on.
The door shut.
Okay.
She right
Oh,
there.
okay. Sorry. So use the use of a coloring book. They're out there. Target, dollar store, um, Michael's coloring books are out there for any person, anybody. Meditation.
Yeah, we can't. Yeah, I'm turning the music out.
Meditation is another form of being able to cope. It's a beautiful technique. YouTube, you can go on YouTube and find a million different types of meditations. 5 minutes, 20 minutes, 30 minutes, just depending on your time. Breathing exercises. When is the last time anybody just actually took 5 minutes to just breathe?
Last time we had one of these.
Okay, so let's take a moment right now. Let's just practice inhaling in for 5 seconds, holding, and then just having a big release. So let's do it as a group right now. So let's breathe in, hold, and now release. How do you feel? So important. Um, Okay, so breathing exercises is something that can be helpful. I'm going to an interview. I just had a really bad conversation with anybody. Take a minute, breathe 5 different times. Once in, hold, and release. Acupuncture. People don't really talk about that. For me, I've seen acupuncture can really help people get out of that depression, out of that anxiety. And it's helpful for other things as well. So don't dispute it. Maybe try it. It is definitely something that can be helpful. Massage. When is the last time anybody actually took a day and actually had a nice massage? So we are working 40 hours a week. We are taking care of kids. We are doing this. We are doing that. We are always so busy. Take the time to care for your body. Massage is a really nice way to ease some of that tension that we're always having. Sound machines, right? You come to my office, you hear a water fountain, you hear the white noise. Maybe I can't afford a sound machine, or maybe I don't even know where to get one. Amazon, your phone, go to YouTube. I want to hear just like relaxing sounds, water, on the beach. You'd be surprised at how it can change your mood within a few seconds of just listening to something. Okay, in your packet, the first worksheet talks about coping with depression. And so it's really looking at, there's different examples. The first one would be behavioral activation, like just getting yourself to just do something small. When you're feeling depressed, you feel very low. You feel like I can't go on. Even brushing your teeth can be something you can do that will help you. So just, look at the different examples. Social support. You have a wonderful community here of different people. Even just calling one person and having a conversation and being able to laugh will help you get out of that. That's one of the biggest things that I encourage people when I'm working with them. Please connect to somebody. It doesn't have to be 10,000 people on Facebook, but one conversation with somebody. Coping with anxiety. So going back to the deep breathing, muscle relaxation, challenging your irrational thoughts. The worksheets that I gave you have all of those different examples in a more in depth, and you can look at them. Coping with trauma. Um, in our community right now, there's so many things that are happening worldwide, nationally, within our own city. We are constantly being exposed to traumatic events. How do we handle that? Some people may want to journal. Maybe you haven't done it in a long time, but just writing down your thoughts is a way to sort of be able to manage that. Being aware of your body, being aware of like different things that help you feel a little better. One of the things that I really like to use with people is like when you are feeling super charged and you've just seen something. I want everyone to practice this one, which is called the 5, 4, 3, 2, 1 technique. So I ask people, I want everyone right now to simply, what are 5 things that you see? Okay. I'm going to ask the lady in purple if you could tell me 5 things that you see right now in this moment.
General with the glasses, find with the glasses, sister in a wheelchair, smiling away, brother they're getting his hair cut on both sides, sister at the door with her glasses with her hair down.
Okay. Can you tell me 4 things that you can feel?
Feel? Feel the wind blowing, like the wind blowing. I feel the sun coming down.
2 other things you can feel. about like physically? Okay. Anything else? The paint or something? Or
It
something
needs
else
good
you can
barber
actually
services
touch?
in. Y'all missing out if y'all ain't at 40 days and 40
Could you
nights
tell me two
community
things that
service
you can
mental
do?
health fair once a month, right, Pastor?
Once a month. Mental health event. Mental health awareness.
Free of charge.
Okay. Could you tell me two things that you can smell?
Come looking raggedy, leave looking A1. Yeah.
I can smell the water with the cucumber. Okay. And lastly, can you tell me one thing that you can taste?
One thing I can taste. Taste.
Yes.
Taste the food.
Okay. So this technique of 5, 4, 3, 2, 1 is something I can pull out